But that's an easy act to follow.
He got all the hard questions.
I want to talk to both of you about drug policy, but also about more largely the opioid problem, the abuse of opioids, prescription opioids. And I want to start on the personal level. Secretary Vilsack, if I could ask you, I shouldn't say nobody, but most people don't think of the Agriculture Department necessarily as the place where you would work on drug control policy. Can you talk a little bit about why you've invested so much of your final year on that topic?
Well, I think there are two reasons. One, because this epidemic is ravaging rural areas that I care deeply about, and it is most difficult in rural areas because we have such a lack of treatment capacity in rural areas. So it's the people I care about that are being impacted, and it's personal. The reality is my mom suffered prescription drug addiction and alcoholism, and I understand a little bit about the pain and agony that those addictions can cause. And I'm deeply concerned about the attitude that we collectively have in this country towards this issue. I will tell you that if there was another illness or disease that cost 28,000 lives, that cost the economy $25 billion of lack of production, that created $25 billion of unnecessary health care costs, I would believe that the Congress of the United States would be falling all over itself to provide the resources to expand treatment and to deal with this issue. They have not done that, and they need to do that.
And this is a bipartisan issue. When you're talking about rural America, you're not just talking about a Democratic Party that's more inclined to spend more on domestic legislation, domestic programs. You're also talking about a Republican Party with a lot of members who represent rural communities who are fighting through this. And I know Chairman Rogers of Kentucky has dealt with drug use a lot in terms of his appropriating. But we are seeing shrinking budgets. How much is the budget a factor in our ability to treat this versus a lot of the other policy and individual challenges?
That's nonsense. You fund your priorities. If you have 10 million Americans who are currently misusing opioids, if you have 2 million Americans that are addicted, 28,000 who are dying, 44% of America knows someone personally that is abusing opioids. It is a massive problem. It needs to be a priority. The President has made it a priority in his budget. He has found the resources in his budget. He said this is a priority. We have to expand treatment capacity. We have to expand personnel. We have to expand prevention. Congress has not yet made this a priority, and what's even more irritating is that they've passed CARA, the bill that basically authorizes essentially what we're doing now, basically says, well, continue to do what you're doing, but not providing any resource, any real resource to implement that bill or any aspect of the President's budget. Again, 28,000 people. This is more than die in automobile accidents. What do we spend on highway safety every year? What do we spend on trying to deal with the situation with gun violence? This is a huge problem that is destroying families, that is crippling our economy in many, many areas, many rural areas in particular. It's got to be addressed. And frankly, we've been dealing with, Michael's been dealing with this a lot longer than I have, but it is frustrating to hear politicians talk about this issue. But, you know, it's really time to fund it.
I mean, I would just chime in here and say, you know, not only is it appropriate in terms of the magnitude of the epidemic, but we can't afford not to do it, right? So why is it okay that we incarcerate someone for $50,000 a year, but yet we can't find the resources to spend, you know, 1/10 of that on treating people? We know that this, it's about not just do we have the resources, but is this a priority? We know that substance use in general in this epidemic has taken a huge toll on our child welfare systems, on our healthcare systems, certainly on our criminal justice systems. And I do think that there is some level of bipartisan momentum to really look at reframing this issue as a public health issue and not a criminal justice issue. But we can't, you know, we can't afford to keep doing things the way that we're doing.
This is a really big point he just made. You don't get to the public health debate and discussion until you recognize what this is and what it isn't. It is a disease. It's not a character flaw. It's not a weakness. It's not something that someone with little willpower can overcome. This is a disease. and it has to be treated as such. If I came to you and said, one of my two sons, we just found out he had cancer, you would say, oh my, that's so sad, what can we do to help? We need to be able to have that same attitude when someone comes to us, and we need to empower them to come to us by saying, I've got a family member who is addicted, or I am addicted, I need help.
Michael, you've seen this from, and I call you Michael because czar seems so formal and scary.
To me too.
You come at this from the perspective of somebody who has battled addiction, and you look at all the way up to the policy level for the entire country. You're talking about somebody who wakes up in the morning, millions of people who wake up in the morning with a craving that is stronger than their desire to eat, that's stronger than their desire to take care of their children, to go to work. This huge, whatever it is, and we're talking about opioids here, but whatever the addiction is, it's that strong, all the way up through the doctors that are prescribing, who aren't making good choices about that. You're talking about the criminal justice system that is punishing people for their addictions. What are the keys in terms of solutions for the future? I mean, we talk about treating this as a public health crisis. I think a lot of people are ready to do that, but what are the keys to trying to solve this problem in a holistic way, all the way up the chain from that person that wakes up struggling with the addiction to the policymaker in Washington?
Sure. So first and foremost, I think we have to look at how do we prevent more, particularly the opioid epidemic. And one of the main drivers of this epidemic has really been the vast overprescribing of prescription pain medication in the United States. So, and a lot of people have roles to play in that. The pharmaceutical industry has a role to play, but physicians have a role to play. And, you know, so in 2013, we were prescribing enough pain medication in the United States to give every adult American their own bottle of pain pills. I'm sure many people in the audience and watching have their own experience. So part of our efforts have been to have more training for prescribers around safe and effective opioid prescribing. CDC just a few months ago released very prudent guidelines for prescribers in how to prescribe these pain medications. But we also have to do a better job at intervening as people's use becomes more chronic. So we have been working diligently to establish state-based prescription drug monitoring programs so that you can identify people who might be going from doctor to doctor to be able to do this. We have been looking at disposal. We know people who start misusing pain medication, get them free from family and friends. So we've been taught as good consumers, you know, if we get a prescription and we don't need it or only need a few, to just stick them in the medicine cabinet. And we know that's often the start of problems. So we've been promoting disposal programs. But I will go back to what the Secretary said. The biggest gap that we see, and the administration continues to do everything that we can, is, you know, despite the advances of the Affordable Care Act providing addiction treatment, we know that there are too many people who don't get treatment in the United States. We just released data that show only 11% of people with a substance use disorder are getting care and treatment for their disorder. 11%. And we know that those other people are overrepresented in all the areas that we talked about. And so while we can do more, the president has been adamant about making sure that people who need treatment are able to get it. And I can't agree more with the Secretary. I just find it inconceivable that in the height of this epidemic, that Congress, not only did they not fund the bill that they passed, but have really not stepped forward in a meaningful way to make sure that people in all parts of the country have adequate access to treatment.
Mr. Secretary, when you look at rural America and you look at the opioid abuse going on right now, and opioids aren't the only drugs that are being abused. As you look at rural America and you look at all the abuse of drugs going on right now, how much of that is driven by economic factors, the ability to see doctors, to have solutions in health that aren't necessarily tied to medication? How much of it was, how much of it drives economic issues in rural America, where you have people who otherwise might be gainfully employed who are addicted and not?
Well, it is complicated everywhere in this country, but I think it's more complicated in rural areas. In part, the nature of work in rural areas makes it likely that you're going to confront a physical ailment or illness at some point in time, an injury. So you are likely to go to that physician. That physician may not have been adequately trained about proper pain management. Although alternatives, there may not be available. Physical therapy may not be available. There may not be a hospital nearby. The second issue, of course, is that if you actually have a situation where someone needs treatment, there's no place to go. There are over 1,000 behavioral service centers in this country that are located to provide services for those who have substance use disorder. Over 1,000. Only 25 of them are located in rural America. That's why the president has said, look, we need resources to be able to expand treatment. It's why he has asked the Department of Agriculture to be creative about the way we use our resources. You wouldn't think the Department of Agriculture is in the business of funding mental health clinics, but we have, over 80 of them. Nearly $250 million has been allocated towards that. You wouldn't think that we would use technology to link up remote rural areas for folks who are in need of help with experts who are located in urban centers through telemedicine. We just recently announced millions of dollars of grants in that space. But we need a significant infusion. It's not just one-off here. We need hundreds of these clinics, hundreds of these opportunities in order to get that 11% to a more acceptable rate.
Your friend Secretary Clinton has talked about rural drug use on the campaign trail. Has she made any commitments to you about what she would do as president vis-a-vis what President Obama is doing, or any other policies that you see forthcoming that might be helpful from her?
It's hard to answer that question because this is an official event, so I have to be careful, very careful. Here's what I will say. You cannot travel in any rural community in this country, in any region of this country, for any period of time without running into someone who will tell you a heartbreaking story about how their family has been wrecked by addiction. You just can't. And then when you talk to the professionals, if there are any in the community, you will learn how limited the resources are to deal with it. You will also learn how hard it is, particularly in rural areas, for people to acknowledge that they have an addiction. You know, it's a self-reliant, self-independent. We're tough. We don't want our neighbors to know all of our problems. It's hard to break through that. So in addition to everything that Michael indicated, in addition to budget, we also have to have our faith-based communities, our community at large, make it easier, make it acceptable, make it okay to talk about this as a disease so that it's easier for people to seek help. I know in my mom's situation, she made the decision, but you know what? In that magic moment when she made the decision, she had a whole lot of help. She had a treatment center she could go to. She had multiple AA meetings that were available. She had sponsors that were there just a phone call away. She had a supportive family. You don't necessarily find that in rural communities, and that's why it's necessary for us to make this more of a priority than it has been.
I also think that, you know, one of the things that we know is you can have, you know, as much treatment capacity as you want. But fundamentally, if we don't change the way that we perceive people with substance use disorders, we know shame and stigma plays a huge role in people not seeking care, in delaying care, contributing to really bad public policy and public laws. So that's why I think both of us talk very publicly about our own experience with this, because it empowers other people to be able to talk openly and honestly about their own struggles. You know, Secretary Vilsack and I have talked to countless parents who and I've got to give parents a lot of credit for how they've stepped forward in this epidemic and are talking very openly and candidly about their struggles, about solutions to this, because, you know, we have got to create an atmosphere where it's acceptable and it's non-judgmental for people to ask for care in the United States.
And Michael, quickly if I could, and Secretary Vilsack too, because we're running out of time here, are you finding that there is more openness and that there is less stigmatism over time? And is that just simply something that's not happening fast enough? And what do you think folks here could do to try to destigmatize this disease?
So a couple things, and I probably have a skewed perception of this, but I do think it's changing. I do think that we're seeing people in recovery and parents being much more open and candid about their own struggles. I was actually just in Philadelphia for September is Recovery Month and marching with 26,000 people in the streets of Philadelphia to talk openly and honestly about this issue. We just hosted, Secretary Vilsack and I hosted in the Roosevelt Room, parents who have come together to talk about this issue. I do see it's changing. I think we have a long way to go. I still read too many articles where, you know, people feel like it's okay or question why we're reviving people from an overdose. Like, really, you know, is that the best way we can spend taxpayer dollars? So we do have a ways to go, but I do think that we have turned the corner in reframing this as a disease and not a moral failure.
I'd just add, for folks in the audience, you need to ask some tough questions of local officials. Do you have access to reversal drugs so you can save lives? So your first responders, are they equipped? If not, why not? Are your schools thinking about ways in which they could create sober schools and sober locations so kids who are struggling with addiction in a high school don't necessarily have to be returned to the environment immediately after they seek treatment, that they are given at least some space to strengthen their ability and capacity to withstand the temptations that occur with any addiction? Asking those kinds of difficult questions, asking members of Congress, you know, what's up with no money? What's up with no treatment? Why aren't we addressing this as aggressively as we've addressed Zika, as aggressively as we've addressed Ebola, other things that have been in the news? You cannot spend time with a mother or father or grandparent who has lost a son and daughter and a grandchild. You cannot spend time with one of those families without being impressed with how much we have to do and how quickly we have to do it. There are lives, 78 to 80 lives lost a day from this, not to mention the tremendous pain that families are suffering today of kids that they're scared to death. Well, you know, that they're going to open up that bedroom door someday and their child's going to be gone. We have to make this a national priority. We have to redefine this in terms of a disease, not a character flaw, and we have to have resources so that when that magic moment occurs, and it does, when you've got a decision to make, which direction you're going to go, you're in a position to get the help you need to save your life.
Secretary Vilsack, Michael Botticelli, thank you very much.
Thank you.